Dr. Jess here. Before I became a doctor of fascia and integrative medicine and trauma psychologist, I worked as a dental hygienist, an accelerated dental hygienist. Reason being is I also specialized in TMJ. I could push out over 600 bite guards within a year, thinking that that was going to help people. But the reality of people came back and I was constantly trying to adjust for the fit, function, inclusion, but it wasn't taking away the pain because in reality, it was not the core issue. The issue really lies within the fascia. And TMJ issues are not just about that pain clicking and popping in the jaw. It contributes to a slew of issues, including headache, not being able to drain your lymph, chronic pain patterns because we're constantly in that fight or flight response because it directly connects with our SCM here, which is along the lines of the vagus nerve. It goes into migraines, headaches. It just goes into this whole pattern. And it actually is one of the leading causes when I'm treating patients for their nagging trap pain, believe it or not. So I created this set in order to give you a streamlined process to let it go and also drain all of the backup from your lymphatic system, brain drain, so that you can have a better flow, better, clearer thinking, just better mood. Everything advances with this, but you truly want to tune into this if you have pain or if you suffer from TMJ. So we want to start with the pull mechanism. In this set, you can use this without the vibration, but I really do recommend the vibration. Reason being is it's really going to help accomplish what we need with the vagus nerve. So you will, one side at a time, you're going to come up the side here and pick up that SCM. So simple. I'm not making you guys do anything by hand, right? We're just going to pick this up and you're just going to roll up a few times. You can see there's no force, there's no pressure. It's just a slow movement that slowly starts to open everything up. I like to just come up and let the vibration come behind the ear. We can go down and up here, down and up. You're going to do this probably for, I would say, about a minute, and you're really going to feel that start to let go. You can already see the drain that's happening on this side of my face. From there, I want you to go and pick up your fascia bar. Reason being, this is also vibrational, but I want you to see what this does when I use it to this side of my face. There's a reason this is also in my beauty luxury kit because it's imperative. So I'm just going to start, you can hear the vibration, and we're just going to pull over to the side here. We have lymphatic drainage points over here. There's a free download on my website of lymphatic points that you can take a look at. I only worry about my lymphatic drainage points truly at the end when we're doing that final push. But we slowly are just coming across, and the reason being is when we have TMJ issues, it causes extreme tension in the entire face. So we're creating optimal blood flow, releasing the nerves. We're getting that hyaluronic acid moving in the fascia, which is comprised of collagen and elastin. Hence why this is a part of the beauty kit, because real skin beauty and your glow is going to come from within. So I'm just going to go ahead and do the whole face to release all of the tension. And then we want to come up and we want to come front and back of the ear. And then you want to use these points to make it super simple to just kind of go around in the ear like this, and it's going to release so much of that tension. You can see from each side of my face the difference already occurring. So the biggest thing that people make a mistake on when trying to release the TMJ or anything to do with the face is so much of the powerhouse comes from the scalp. This is the reason the restore is in this kit, because you want to be able to let go of the scalp, and nothing is going to do this faster and more efficiently than using the restore. We can, with the scalp, we can do a therapeutic pull, which you're grabbing your hair down right towards the root and you're imagining lifting that scalp off of the skull. If you don't have hair, you can definitely purchase a cupping and use it that way, or you just go directly to the restore, and you need to come through from front to back, and you kind of do the jiggle as you're going through. If I hit an area of tenderness, I kind of just want to stay there for a little bit until it starts to let go. You will feel that tenderness become less, so then we can move on. You want to do this all the way through, front to back, and all the way up, and then you want to come up from the back. The beauty with the restore is this is designed so you cannot hurt your spine. We want to put this on each side of our spine, going like this, pushing up into the occipital, and releasing on each side. It's just a little jiggle. There's not much force, but you start to come into that alignment. To go along with the restore, why we put the fascia spark in here is I want you to be able to roll out this tension through the muscles on the face here, coming right underneath your jawline. You can see I'm not putting much pressure. Nothing I create is about force. It is just about allowing that fascia tissue to let go, and you will see such a huge change so quickly. And this does hold. Your fascia will hold. It will recreate itself. So if you're consistent, protocols start with doing this anywhere from 2 to 4 times in a week. Maintenance schedule can look like 1 time a week. You just have to start working to get it to remember where you want it to be, and this doesn't have to occur all the time. This is really important to roll out through the chest area also. We can use our roller for that. So after I roll out the chest area, I can go back, and I love to use the cooling globes of the Schveldt. And here we go up on the face here, up and over. You guys, these are like ice cubes. It feels so good. You also want to roll up again here through the SCM, and I would roll out the chest, making sure the chest is all clear. And then I like to do the final exhale of one more going back with the push, making sure we're just releasing all of tension and buildup in the final exhale of the push. So you'll see with this set, I have gone between the pull, the pulse, and the push. Those are your 3 anchors in order to release the fascia in a way that is not going to bruise, it's not going to cause harm. And you guys just look at my face. You can see that I have now drained this whole side of my face, and we have a little higher here with the eyebrow. I usually do my maintenance regularly, so there's not going to be as huge of a difference if I were working on somebody else, but you can see how much has gone down. So now I have to do the other side so I'm not lopsided. But pick up this kit. If you're a dental professional, if you suffer from headaches, trap pain, if you're constantly in a state with anxiety, I will have my patients, if I'm doing the psychotherapy or trauma side of things, they will literally just roll the SCM or use one of my tools on themselves as we're doing psychotherapy, because you want to hit the physiological part of the body along with when you're working the mind. I am telling you, the system is a true powerhouse, and we're only going to keep going.